This is the blood vessels and circulation. This model is the circulatory model. First we'll look at the pulmonary circuit. The pulmonary arteries are going to be branching off of the pulmonary trunk, and they are, there's one right pulmonary artery and one left pulmonary artery. The right pulmonary artery will be going into the right lung. The left pulmonary artery will be going into the left lung and bringing the deoxygenated blood to the heart or to the lungs in order to be oxygenated. Then returning from the lungs to the heart, we have 2 pulmonary veins from the left lung and 2 pulmonary veins from the right lung. And those are red because they are now oxygenated. And that is our pulmonary circuit. For the rest of the blood vessels, we'll be working with a systemic circuit. Arteries will be red because they are contain oxygenated blood. Veins will be blue because they contain deoxygenated blood. Starting in the systemic circuit at the aorta, we have the arch of the aorta, we have the ascending aorta and the arch of the aorta. Off to the right side of the body, we have the brachiocephalic trunk. The brachiocephalic trunk will divide into the right common carotid artery, reaching up into the neck, and the right subclavian artery going down to the shoulder area. Also coming off of the arch of the aorta, we have to the left side, we have the left common carotid artery coming directly off the arch of the aorta, and we have the left subclavian artery coming directly off of the arch of the aorta itself and going to the shoulder area. Okay. If we look at the subclavian arteries, the subclavian artery is not going to change its structure, but as it reaches certain anatomical parts, it's going to change its name. So the subclavian artery, as it passes by the first rib, then becomes the axillary artery. And we see that in the axillary area. Then as the artery passes through the axillary area to the upper arm, we then call this same artery the brachial artery. We can also see it on the left side of the body. Here's the left subclavian artery and the left axillary artery and the left brachial artery. In the lower arm, we have 2 arteries. The radial artery that is on the lateral aspect of the arm towards the thumb side, and we have the ulnar artery, which is on the medial aspect of the arm on the pinky finger side. Going back to the heart and the aorta, we have the ascending aorta, the arch of the aorta. Then we have the descending aorta, which is also called the thoracic aorta, as it descends through the thoracic cavity. It pierces through the diaphragm, and once it does so, it becomes the abdominal aorta. So we see this large red structure here called the abdominal aorta. As soon as the abdominal aorta pierces through the diaphragm, there is a trunk that comes off of the aorta that's called the celiac trunk. And what you're seeing here is the celiac trunk as it's dividing quickly. It's a very small trunk, and it divides into arteries that will help to supply the liver and the spleen and the stomach. If we go a little further down, a little more inferiorly on the abdominal aorta, we see another trunk, and that trunk is called the superior mesenteric artery. The superior mesenteric artery will send branches off to the right side of the intestinal area to supply those structures. We also see 2 other organs laying off to each side of the aorta. Those are the kidneys. And so there are 2 renal arteries that are going to supply those kidneys coming from the abdominal aorta. So we have the left renal artery and the right renal artery. As the abdominal aorta reaches the lower abdominal area, it's going to bifurcate and divide into 2 common iliac arteries. Those common iliac arteries are going to divide quickly again into an internal iliac artery. And this internal iliac artery will dive deep into the pelvic region, and then an external iliac artery. As the external iliac artery pierces through the inguinal region, it then becomes the femoral artery. If we look at it on the right side of the body, here we have the external iliac artery. It crosses through that inguinal region, and then the femoral artery here has been cut off, so we're not seeing the remainder of the femoral artery on the right side. So what we see here on the muscle man is the heart is gone, it's missing, but we do see this structure, which is the arch of the aorta. And as the aorta starts to descend through the thoracic cavity, we call this the descending aorta or the thoracic cavity. The branches that come off of the thoracic aorta are the intercostal arteries. So if we look in between the ribs, we can see intercostal arteries running alongside veins and nerves in between the ribs. We can also see although we don't see the heart again, we can still see the pulmonary artery as it's leading into the lung, and the pulmonary vein as the oxygenated blood is leaving the lung and going back to the heart. Going back to the thoracic aorta, as it descends down, it'll pierce through the diaphragm, and right when it comes through the diaphragm, it becomes the abdominal aorta. So this whole area in here is the abdominal aorta. The first branch off of the abdominal aorta is the celiac trunk. And so we just see this little stub here of a branch, and that's going to come off and branch right away into branches that will supply the liver and the spleen and the stomach. As we descend a little more inferiorly, we see the superior mesenteric artery that's coming off the abdominal aorta. That's going to go off to the right side of the abdominal area and supply the right intestinal structures. Also at about the same level as the superior mesenteric artery, we see an artery coming off of the abdominal aorta that's called the renal vein. It's entering into the kidney. And then we can see that on the left side and then also on the right side. As the abdominal aorta gets down into the inferior aspect of the abdominal cavity, it bifurcates into common iliac arteries. We have a right common iliac artery and a left common iliac artery. And very quickly, that common iliac will divide and separate into an internal iliac artery that dives deep into the pelvic area, and then an external iliac artery. The external iliac artery will pass through that inguinal ligament and down into the leg area, where it then becomes the femoral artery. In the lower leg in this unit, we have to identify two arteries. On the posterior aspect of the leg in the calf area, we see the posterior tibial artery. And in the anterior aspect of the leg, we see the anterior tibial artery. This is the muscle man leg, and I'm showing you that after the external iliac artery passes through that inguinal region, it then becomes the femoral artery. So we can see the femoral artery here. We can also see the two other structures that we need to know in the lower extremity. On the anterior aspect of the leg, we see the anterior tibial artery. And on the posterior aspect of the leg, we see the posterior iliac artery. This is a muscle man head, and finishing the arteries, we can see that the carotid artery runs all the way up the neck before it divides into the internal and external carotid arteries. And then starting with the veins, we'll start right away with these veins here that are the brachiocephalic vein that's draining into the superior vena cava. So we see the brachiocephalic vein on both sides. And the branches off of the brachiocephalic vein are the internal jugular vein and the external jugular vein. This is the vascular arm, and it's sometimes a little more difficult to find the structures because you don't have a lot of anatomical structures to lead you there. So we can see the axillary artery. We can also see the brachial artery down in the brachial area, this red vessel down in here. And then if we look in the forearm area, in the antebrachium area, we can also see the radial artery. The radial artery is right here, red. And we can also see the ulnar artery right here. This is much better seen. Okay, this is the muscle man, the arm of the muscle man, and I'm going to show you that the subclavian artery, as it passes by the first rib, becomes the axillary artery. So we're seeing the axillary artery right here. And as it passes through that axillary artery into the brachium, it then becomes the brachial artery. The two structures that we need to know in the lower aspect of the arm, we can see that the superficial muscles have been taken away. We can see on the lateral aspect the radial artery. It's on the thumb side. And on the medial aspect, or on the pinky side, we can see the ulnar artery. And then we'll look at the veins right away in this model. In the vascular arm, there's two veins that we need to know. There's the axillary vein that runs alongside the axillary artery. And then we have the median cubital vein that we see in the cubital area. The vein where many venipunctures are done, actually. Okay, so the superior vena cava is formed by the two brachial veins that merge together to form that superior vena cava and drain blood into that right atrium. Branches off of the brachiocephalic vein are the internal jugular vein and the external jugular vein. The brachial vein then becomes the subclavian vein as it starts to course down into the arm. The inferior vena cava we can see below or inferior to the diaphragm. We don't really see it coming up into the right atrium above the diaphragm, but draining into the inferior vena cava, we can see the renal veins draining the blood from the kidneys. So there's the right renal vein and there's the left renal vein. And then also helping to form that inferior vena cava, we have the common iliac veins that are joining together to form that inferior vena cava in the inferior aspect of the abdominal cavity. The common iliac veins are made up of the internal iliac vein and the external iliac vein as they join together to form that common iliac vein. As the external iliac vein pierces through that inguinal region, we are no longer able to see that femoral vein as it's been cut off, but we can see another branch that is called the great saphenous vein that runs all along the medial aspect of the thigh and the lower leg. This